Hello, I'm Dr. Scott Fowler. I am at the Premier Family Care Clinic in Broken Arrow, Oklahoma, 1130 East Lansing. We're here today to talk about some basic medical information. One of the first things we wanted to talk about is how coronavirus has affected other things besides coronavirus itself. A lot of children are not getting their well child checks for fear of going out in public and getting exposed to coronavirus, so they're not coming in and getting their developmental screenings and getting their vaccinations and things like that. The World Health Organization predicts that there's going to be some problems with some preventable diseases because of that in the near future, and it's something that we need to definitely address in the short term to remedy that. The other thing that it's doing is it's keeping adults and older patients from coming in and getting their screening exams too. Things like colonoscopies, cholesterol checks, blood pressure checks, things like that. So coronavirus is causing quite a few problems in and of itself, but it's also indirectly causing a lot of medical issues with patients' preventative care. So the CDC is recommending quarantining in the home whenever possible, but it doesn't say that you don't need to get your medical care. Your medical care is still very important. We do recommend that you bring a mask anytime you come out. We're doing extra diligence to make sure that the rooms are cleaned after each patient. If we have a suspected coronavirus patient, not only do we clean the room, but we shut it down for several hours or even for the rest of the day to make sure that if they are coronavirus positive, the next patient's not exposed to that unnecessarily. We were also all wearing masks while we were in patient care areas. We're also doing extra work to make sure our hands are clean. Medical people are pretty good about keeping their hands clean anyway, but we're doing even some extra things around the clinic. So if you're wearing a mask and I'm wearing a mask and it's just a normal office visit, your risk of getting exposed or me getting exposed is very trivial. Again, it goes back to prevention. So most schools require certain vaccinations, and if you're behind on those, they're probably going to not let you come back to school. Those are one of the most important things. It's also a good idea if your child's going to play sports to get a sports physical to make sure that there's nothing going on with the heart or the lungs that could cause some problems during athletics. Those are both some pretty simple and basic ways of doing some prevention. And those things are getting dropped right now because of coronavirus. First of all, I'd say don't delay it. Your healthcare is very important, and even with coronavirus, it's more important than the risk of getting coronavirus if you take proper precautions. So mask, gloves, hand sanitizer, proper sneezing and coughing into the inside of your elbow. If you're doing those things like you should, it doesn't prevent you from getting the healthcare that you need and the screening tests that you need.